But that's where the money goes also.
That's what it is.
Yeah. But so anyway.
Yeah. So we stopped the hormones. So it went to a hard stop, like Dr. Kessel said. And then kind of the pendulum started to swing again, huh?
Yeah, but it never came all the way back. I mean, and I don't think it will. And even now, I mean, we're 20 years after this study. I still had patients that were bringing it up.
Yes.
You know, what about the 30% chance of breast cancer? And then I have to start all over, going back to this is 13 cases per 10,000 versus 20 per 10,000.
Yes.
You know.
Yeah.
And the things that they have seen lately are if you are on hormone replacement therapy, it's for the person who really needs it. It's for the person whose quality of life is affected by their symptoms. And we kind of go by the lowest possible dose for the least amount of time kind of rule. But they're starting to, the newest thing is that most of the breast cancer risk is seen after year 5. So when you, between this year that you start it, hormone replacement, and 5 years, that's when they start to see the increased risks of breast cancer.
But is that increased risk still pretty small?
Yes.
Yes.
And again, that increased risk is in the estrogen plus progesterone. So
not estrogen
alone doesn't appear to increase risk.
They said maybe by like year 7 for estrogen
so here's another
alone.
question then.
It's kind of
What is the problem with? I know we don't want to do unnecessary surgery, but what is the problem with doing a hysterectomy, and then just estrogen treatment? If you know, you're a woman and you want to just prevent osteoporosis or decrease your risk of significant osteoporosis and maybe some other health associated risks, right? With if you want to just use estrogen, it seems like you would have to be missing your uterus, right? That's what you guys are explaining to me, correct?
just estrogen?
Yeah.
Yeah.
Is that correct?
Yeah, but see, I don't think it's ever going to become policy that you can get a hysterectomy
As
just
treatment for menopause.
for the ability to take estrogen
Got it.
only.
Yeah.
But that being said, women that were on the board of trustees of the North American Menopause Society have told me, they wouldn't say this at a microphone, but in retrospect, they're kind of happy they don't have a uterus.
Right.
Because they can take just estrogen.
Yeah.
So they're happy about it, but they didn't have the hysterectomy for that reason. They're
Yes.
just happy about it in retrospect.
Right.
Yeah.
And hormone replacement therapy, Dr. Kessel, is most effective for what symptom?
Oh, any of the symptoms like hot flushes, night sweats, sleep disturbance.
Yes.
And then, again, osteoporosis prevention.
So it's really good for the hot flashes and the quality of life and the sleep and things like that.
Interesting.
Yeah.
Well, then later on, though there are different approaches to this, the vaginal dryness issue
Yes.
can be treated with a local vaginal estrogen. So you don't have to take an
It's like a
Oh,
cream.
okay.
Yeah, you don't have to take an
suppositories.
estrogen pill circulating throughout if the main issue's just in the vagina.
Yep.
You can take a tablet or a cream in the vagina.
Yeah.
And,
And you can do that even if you've had breast cancer. So some of the breast cancers, so the
It's from
people
the
who
oral is from oral administration
so
or
the,
higher with oral.
the people who have had a history of breast cancer, we usually will not offer the oral hormone replacement therapies or the systemic
Got it.
hormone replacement. We can, though, in some instances, and they haven't found an increased risk of technically fertilizing any breast cancer systemically, you can use it vaginally, and that's okay.
So why wouldn't you just stick with just that then? Like why
Because
wouldn't
it
you just
doesn't take care of the hot flashes
Yeah.
Oh, I
and the
see.
symptoms
I see.
associated. So it's just for vaginal dryness.
I see. Okay.